Hello, my name is Valerie Radant, and this is my peripheral vascular assessment. For the purpose of this video, I will be assessing through clothing. In the clinical setting, I would be assessing with bare skin. So hello, my name is Valerie. I'm going to be your nurse for the evening. I am going to be doing an assessment of your arms and your legs. So first, I am going to observe the arms. I am going to note any size difference between the two arms. If I do notice that there is a difference, I can measure it for a more accurate reading. I'm also going to observe for any edema. Any edema would be an abnormal finding. I'm also going to observe skin color. He has great skin color right now, but if he had any whitish tint to it, that would be an indicator of pallor, and that would be an abnormal finding. Also, if he had any dark red patches, that could indicate some cellulitis, but for now he has some great coloring. So next I am going to inspect and to palpate the arms. I am going to just feel for the temperature difference from the upper, lower, and the hands and the fingers, and I'm going to do that on both arms. I'm also going to see if there is a difference in the temperature from one arm to the other. Next, I'm going to assess capillary refill. I'm just going to take one of his fingers, press down on the nail, release, and his color came back great. But if the color doesn't return within 3 seconds, that is an indicator of some decreased cardiac output, which is a abnormal finding. So the next I am going to assess the radial pulse. She has a great radial pulse. Next, I can also assess the brachial pulse. And I can also perform the Allen's test. I am going to have my client make a fist. With his hand, I am going to press down on the ulna and the radial side. I will have my patient release his fist, and I will release on the radial side, and I will watch as the color returns to his hand, which he has great coloring. So next I am going to move to the legs. I am going to do the same as I did for the arms. First, I am just going to observe the general size. If I had any suspicion that one leg was bigger than the other, I could grab a measure and measure just like I would for the arms. So after that, I'm also going to observe the color. Just like for his arms, he has great coloring. If I noticed any white or gray tinge colors, that would indicate pallor, which he does not have. And he also does not have any red spots, so that does not indicate him having any cellulitis. So next I am going to feel the temperature of his skin, just like I did for the arms, of the upper, lower, and his feet. She has great temperature. If he had warm skin on one side of his leg and either hot or cooler skin on the other side of his leg, that would be an abnormal finding as well. So next I would just palpate the femoral pulse. In the clinical setting, I would move down the blankets, but I would still keep the patient private. Next, I would have my patient move up his leg a little bit, and I would palpate his popliteal pulse. And next, I'm going to move down and I will palpate his radial pulse. And his pulse right there. Now, if I am having any difficulty palpating any pulse, which could be an abnormal finding, but it could also just be to any edema that the patient may have, I can use a Doppler to properly palpate. All right, so that completes my video. Justin, thank you very much for being a great patient. Thank you very much.